Hello, my name is James Spiro, and this is CTech's Out of the Bubble series. Joined now with Ofer Levy, the CEO at ZygoFix. Ofer, hi.
Hi, nice to meet you.
Thank you for taking the time. I see that you've brought a prop with you today, and it looks like a spine. So
I always walk around with a spare spine
Right.
ever since starting ZygoFix.
Yeah, so please, can we talk a bit about that and what you folks are doing and in relation to the prop we have here today?
Sure, of course. So ZygoFix is a spine technology company started here in the north of Israel, in Misgav. What we have developed is a spinal stabilization system that is simpler and intended to provide a less invasive solution for back pain, chronic back pain sufferers. Spinal fusion is the name of the procedure. It's a common surgical procedure which is performed for patients that endure pain due to pressure applied on their spinal cord or one of the nerves that stem out. So actually our spinal cord runs down here and there are nerves exiting from each of these branches. And in many of the occasions, there is pressure applied on these nerves, and this causes the pain. As this is the lower back, these nerves run down to our legs, so the pain is a lot of times felt in our legs, but it's actually radiated from these places. And the purpose of this procedure is actually to relieve the pressure from the nerve and stabilize the segment in order to ensure that the pain is not applied again.
Okay, wonderful. Thank you. I know that there are plenty of people that will benefit from this, myself included sometimes. Are you folks the first people to be doing this? What makes this special?
So fusion procedure is a very common surgical procedure. I think it's the most common surgery for chronic back pain. And there are existing hardware who provide this stability. The standard way that this stability is provided today is by placing a pair of screws, two pairs of screws actually. These are driven into the involved segment into the pedicle, into the vertebrae, and connected by a rigid rod, sort of like creating an external artificial bridge. And this is placed bilaterally in both sides of the spine in order to ensure that stability is provided. It's a very common way for us carpenters to think on how to provide stability. What ZygoFix has thought, again, and this is the concept that we have started the company based on, is that when we're looking at our anatomy, it seems that most of that bridge exists naturally in our bony construct. And the only motion remaining is in these small joints, which are called the facet joints, or actually zygapophyseal, which is the source for the name of our company, ZygoFix. So what we set out to do is develop an implant which provides the stability by inserting into this joint and stabilizing it from within. By that, we can provide a much simpler procedure, much less invasive, and one that is capable of being performed as an outpatient, which is a much simpler procedure for the healthcare system and for the patient, for the surgeon, for the entire system.
Okay, it seems a lot less intimidating than having this in your spine.
I agree, and we get plenty of emails from patients who are searching the web for an alternative solution. Their surgeon said, "Okay, you need to have a surgery with the screws," and they seem intimidated, so they ask us if they can use our implant.
Okay, has this been used clinically?
Yes, so we have been in a clinical study for over 4 years. Actually, clinical study is the main event for a company like ours. This is the most important evidence to showcase our technology and to be able to provide to regulatory authorities, to reimbursement, to surgeons, to the market. So we've been focused on performing a clinical study. We've been in a clinical study for over 4 years, focused in Europe, and a small one in Israel here as well. We've been advancing very well, and we see very good outcomes in terms of pain reduction, long-term pain reduction for these patients. And we're now focused on opening a larger 100-patient multi-center study in Europe.
Oh, wow. Well, that sounds wonderful. I can't wait to hear how it all goes. And I hope that by the time I eventually reach the dreaded back pain stage, that folks like you will be relieving some of that pain.
So I say you maybe try to devote a bit of time for yoga and Pilates these days, and maybe we can prolong the time that you need to come into surgery.
I think I'd rather have that in my back.
Yeah.
Ofer, thank you so much.
All right, great.
Cheers.
Thank you.
Thanks.